enter the room.
Good morning. My name is Kamarali. My GMC number is 12345. May I proceed, please?
Please do.
Thank you. Good morning.
Good morning, doctor.
I'm Dr. Ali. I'm one of the doctors here in the emergency department. Could you confirm your name for me, please?
Yes, I'm Joe Mooney.
Sorry, could you tell me that again?
It's Joe Mooney.
Thank you so much. Is it okay if I call you Joe?
Yeah, that's fine.
Thank you so much. Could you confirm your date of birth as well?
I'm 55 years.
Okay. I can see from my notes here that you have a tummy pain. Am I correct?
Yes, doctor. It's been really bad, this pain.
I'm really sorry to hear that. Could you tell me a little bit more about what happened?
Well, it started yesterday, and
Mm-hmm.
it's the upper part of my tummy. Yeah, and
Oh,
it actually started after I had a drink
mm-hmm.
yesterday.
I understand. And have you had this type of pain before?
No, nothing like this.
Nothing like this. Okay. And is it constant from yesterday till now, or does it come and go?
No, it's been there. It's been very intense. I feel like it's spreading to my back.
I understand. Are you comfortable in proceeding, or would you like me to give you some painkillers?
I mean, it would be great if you could give me painkillers, but as you make the call.
Yeah, sure, Joe. All right, so I will ask you a few questions just to understand what's happening with you. Just bear with me with a few minutes, please. You mentioned that it started with alcohol. So how much did you drink yesterday?
Well, yesterday I kind of had like heavy drink, you know,
Mm-hmm.
with my friends.
Yeah.
I would say a few beers. I kind of lost count.
Mm-hmm. Okay. And was it on empty stomach?
We were having snacks here and there.
Mm-hmm. Okay. All right. And is there any particular thing during this period that increases the pain?
Um, well, not that I've noticed anything, but it's
Mm-hmm.
constantly there. It kind
Understand. All right.
of lean forward.
Sorry, it can what?
It kind of gets better when I lean forward.
I understand. Anything else makes it better?
No, not that I've noticed.
Okay, all right, Joe. And on a scale from 1 to 10, 10 being the worst possible pain, how would you rate that pain now?
I don't know, something around 8, I guess.
Oh, I'm really sorry to hear about that. We'll make sure that you get comfortable as soon as possible, Joe.
Mm.
Any other symptoms that you've noticed, maybe nausea, vomiting?
Yeah, I feel very nauseous, and I vomited a couple of times, about
Mm-hmm.
3 times since the pain started.
I understand. And have you been feverish by any chance?
I don't know, I haven't noticed that.
Okay, all right. And how's your bowel movement? Are you going to the bathroom normally?
Well, I passed gas.
You pass gas. Okay, all right. Apart from this pain and the vomiting, have you noticed any other symptoms at all?
I don't know, like what, doctor?
Like any problems with urination, maybe?
No.
No. All right. Okay. Do you have any long-term medical condition, Joe?
No, doctor.
No. Do you take any medications?
No,
No. Are you allergic to any medications?
not that I know of.
Okay, all right. Any history of any problems with your pancreas or any family history with pancreatic disease?
No, not that I know of.
Okay, and have you by any chance been diagnosed with any stones in the gallbladder? Any problems there?
No, doctor.
No. All right. Thank you so much. And what do you do for a living?
Um, well, I own a diner.
Okay. And how do you find this pain affecting your life?
But I mean, since it started, it's kind of been really bad. I don't think I can do anything with this
I
pain.
understand. I understand. Could you tell me a little bit more about your drinking habits in general?
Well, I kind of like drinking, and yesterday I think I went a little overboard.
Okay, all right, I understand. All right, Joe, I would like to perform an examination on you. This will involve me looking and like touching and also listening to your tummy. Would that be okay for you?
All right, yeah,
Okay, and also I would like to take your observations that include your blood pressure, your temperature, your oxygen, heart rate, and respiratory, which is breathing rate. All right.
okay.
Okay. Okay. All right. So Joe, from what you've told me so far and from the examination, I believe that you might have in a condition that is known as acute
2 minutes
pancreatitis.
remaining.
Have you ever heard of this before?
Yeah, is there something wrong with my pancreas?
So the pancreas, which is a really important organ in our body, it sometimes can get inflamed. When this inflammation gets really bad and quick, it's called as acute pancreatitis. So are you following me till now?
Okay, all right. Yeah,
All right.
so what's the next step? What's going to happen now?
Yeah, all right. So I'll tell you exactly what will we do. Before, we will start with stopping anything that you take by mouth. So nothing to eat or drink for now. We'll start you on IV fluids, like fluids by the vein, and also with analgesics, which are painkillers to help with the pain. We will also do some investigations to understand more. We'll do a CT scan of your tummy, and also we will take some blood sample to run some investigations to understand better of your situation. So how does this sound to you?
All right. Do I have to stay in the hospital for this?
Yes, we will admit you to the hospital. We will inform the senior, and they will be running some investigations to help you with the pain. So do you think you can do that?
Yeah. Is this serious, doctor?
I would like to tell you more about why it happened. So actually, yes, it can be serious, but since you've come to the hospital at the right time, we'll be able to help you with that. But the most important cause of what you're having now is the drinking that you've been, the alcohol that you've been taking. So it's really important that you do not exceed the normal limits that the person can consume, which is about 14 units per week. I will give you a leaflet about the.
Move on to the next station.
Good job, doctor. That was really well done, I have to say.
Thank you so much.
Yeah, I see someone is raising their hands. Yes, doctor, you want to add something, Dr. Alp? Yes, Dr. Alp. Okay. All right, so that was great. All right, so good job in understanding what the diagnosis was. And I just want to ask you, like, how long into the conversation or the consultation did you realize this was acute pancreatitis?
Um, like maybe when it was 3 minutes left, just before I did the examination, I was having a doubt. So I thought maybe it's related to the esophagus, maybe it's perforation, if he's taken any medication or whatever. But I thought also about pancreas. So I had these two doubts, and after that, I concluded this is pancreatitis.
Yeah, well, good job, good job. That's great. And
Thank
the other things, what it could be, you can actually think of any peptic ulcer disease, right?
Yeah.
Ask about vomiting, blood
Mm.
in the vomitus, right? Like since he mentioned vomitus, what were the contents of the vomitus? Just to understand, if there is any active bleed. There is
Yeah,
another
that's correct.
condition called Mealy-Weiss.
Mallory Weiss tear of the esophagus, you mean, right?
So what happens in that is that you actually have a lot of hematemesis, So when he
Mhm.
actually mentioned vomiting, you
That's
can
correct.
actually rule that out right there, since vomiting is something that could lead you to think along the lines of and vomiting and alcohol is
Mhm.
something that you think along the lines of, some esophagus or stomach related condition. So you can quickly ask questions related to that just to rule that out, right? And the
Mhm.
other important clue that was actually helpful for this case was, the factors that were would relieve the pain. You might not always get it, but once you actually get something that is related to a condition, hold on to that, then you actually have gotten your clues for what it could be. And, try asking questions more towards that. Because once you get your diagnosis, jump into management. Right, because the thing is that you have a total of 8 minutes, and towards the end, I think you got to management when only 2 minutes was remaining, right? And quite frankly, to get those 4 marks for management, you might need a little bit more time. Right, so you had to talk about a lot of things like admission, nil per oral, understanding that he has the risk factors, which is alcohol, that is causing him causing this condition. So you have to bring about the connection and the link that the alcohol, the binging of alcohol or the alcohol consumption is what could most likely be causing this, right? Management is very important. So, when the data gathering is basically to understand how much, how fast you could basically get in, get acquainted with what the condition is, rule out any emergencies, and then come to the management and explain that to him, and explain it in a way that, it does not cause any future episodes. So when you're actually thinking about this patient, if you were to, leave this patient, you have to leave him in a condition where this doesn't happen again, right? You equipped him enough so that, he knows about this condition and would take the right measures so that this doesn't occur again. Could you say you've done that entirely?
No, because I couldn't explain the cause, which is the alcohol.
Absolutely, alcohol and lifestyle measures, and finally, to completely equip him for, understanding this condition better, talk about leaflets, pamphlets, arrange a follow-up with the GP after he's been discharged, talk about the warning signs he needs to look out for, if this happens again, what to do, right?
Yeah,
so this is completely equipping him on, dealing with any future attacks.
So I have a question, doctor.
Yes, absolutely. Go ahead.
Are we obligated to complete all the information in data gathering, even if we know the diagnosis? Like, let's say by 2 minutes, I concluded this is acute pancreatitis. Should I ask everything in data gathering, or should I just pick the things that are relevant?
That's a very good question. And yes, pick the things that are relevant. Pick the things that are relevant to your consultation, or else you're just wasting time, right? So whenever you are going forward with your consultation, the best way to go, to actually deal, start with your conversations is by starting with open questions. So that way the patient says a lot. So a lot of your Socrates gets covered. And then the questions that are leading you to, understand the condition better, or are leading you to your diagnosis, and at the same time ruling out any red flags, any acute emergencies, you have to do. So whenever you have a condition, your first prerogative is to understand what the condition is. And also at the same time, you have to make sure that there are no emergencies that is, likely associated to him right now, right? So once you've done that, you can be assured that you're a safe doctor, right? Asking all the other questions might be unnecessary, because ultimately you have to dedicate that much time for management as well, because quite frankly, no matter how many questions you ask in data gathering, the maximum you can get is just 4 marks. What about the rest of the 4 marks that can actually help you, perform better than the other candidates, right? So you have to, dedicate adequate amount of time for that aspect as well, right? Because if you ask a few more questions, it might not actually help you in anything. You're just asking the questions all because you know that these are the questions to be asked. If you had the luxury of time, probably, but in these cases you just have 8 minutes, right? So think about that, especially because when you have a lot to talk about, once you get the diagnosis, think about all the things you have to talk about in management. right? Because you've got a risk factor, you've got, it's an emergency, so you have to admit him. So, there is an immediate management that you have to do, right? So, and there are a couple of other long-term management that you have to, mention to him so that it doesn't happen again. And always try to include these three things, which is very, which is followed on a regular basis in the NHS, which is leaflets, pamphlets, because the NHS prints out like multiple leaflets on every topic so that the patient is well informed about their condition. And that's the best kind of patient, who actually have a credible source from which they can read out of, right? And that's something that you have to provide. Even if you're admitting the patient, you have to give them information that they can look up on about that disease, right? So leaflets, pamphlet, any warning signs, anything that could actually cause complications, any symptoms that they have to look out for, and talk about the follow-up that you're going to be arranging for them, right? So always try to include these three things in your management, because that is how you actually make it like a holistic kind of a management. Ultimately, you're not treating just the condition, you're treating the person, right? But I really like the questions that you asked, because you were direct, you were actually not just treating the condition, you were also treating the, the person by understanding the impact that it was having in his life, and that way, trying to offer him any additional support from your end, right? So that was right. Right. So let's quickly look at the performance. Just hold on a minute. I'll just pull up the performance view. Just one more. All right, let's look at the performance then. All right, so confirm full name and age. That's very important. Always when you're actually starting the conversation, always try to start the conversation by identifying your patient correctly. Clarify the setting and purpose using an open-ended question. Introduce yourself as a doctor in the A&E and ask, can you tell me a little bit more about what brought you in today? Either you can say it like that, or else you can always use the information that you have been provided in the candidate information, because this is the only information that would be given to you. That's all you know about the patient. So use it, right? So that this person has come with severe abdominal pain. So mention it, because you're kind of saving time by doing that, right? So I can see from my notes that you've been experiencing some severe upper tummy pain. Could you tell me a little bit more about this? That's an open question, because you've already addressed one of the part of the symptoms, right, which is the site, right, and the severity, and you're actually asking him to describe more, so that you can tick off other aspects of Socrates. Yeah. So use the candidate information to the best of your abilities, because that's something that actually does save time. And then use Socrates method to thoroughly explore the abdominal pain, site, onset, character, radiation, associated symptoms, timing, exacerbating and relieving factors, severity. So that was very well done. Have it like a conversation. Understand literally every aspect of the pain, so that it would give you a better idea of what it could be. Screen for other conditions, like peptic ulcer disease, ask about NE, burning, epigastric pain, acid reflux, indigestion, screen for cholecystitis. So, let's talk about the other conditions that could actually lead to acute, pancreatitis. So alcohol is one of the risk factors that you mentioned. Yeah, and that was the risk factor that was found positive in this patient. But what about the other causes?
Gallbladder stones.
Absolutely. That's one of the most common causes, along with alcohol. Otherwise, it can also be idiopathic. There can be some genetic predisposal as well, right? So, yes, screen for any cholecystitis, ask about any history of similar pain, especially in the right upper quadrant pain, and relation to fatty meals, right? So I would say I'll give a partial, because you mentioned, have you experienced something like this before? That's a good question, right? Rule out any intestinal obstruction. So that is one important thing. That's one risk factor that you have to, that would be an emergency, right? So good job on asking about the bowel. So he mentioned that he's passed some flatus. So that gives you an idea that it's not a bowel obstruction. So good job there. Take a full PMAF2 history, past medical condition, medication, allergies, family history, recent travel, smoking, alcohol use, and previous surgery. So out of this, even though you have the entire PMAF2, choose from there which are the important questions to ask, right? And I think you did a great job there. Explore, and since you've understood that alcohol is something that he is which is a major risk factor, and you have identified it, so good job on following it up and understanding a little bit more about it. Ask about how much he drank last time, drinking patterns in general, and previous complications from alcohol. Yep, I'll give you a yes to this one. Perform focused physical examination, comment on appearance, abdominal tenderness, absence of guarding, rebound tenderness, negative Murphy sign, and check for further features of peritonitis. All right. And then after you've done that, so that's your data gathering. Now your management. Explain likely diagnosis in layman terms as acute pancreatitis relating to alcohol use and inflammation of the pancreas, right? So in that explanation itself, you can actually bring about the correlation of why this has happened, right? So this is most likely, I'm suspecting this is most likely due to your drinking habits, which is a major risk factor in causing this condition. Right, so right away you've actually gotten that out of the way. You've made him aware of the fact of why this is happening to him, right? Order blood test, full blood. Okay, so which of the blood tests that is important? Which is the diagnosis of choice when it comes to acute pancreatitis? It's an open question for everybody. Anybody who wants to answer? Investigation.
Serum lipase.
Yes, absolutely, Dr. Sara. That is serum lipase. That's absolutely correct. Amylase is a little less specific because you can also see them in any intestinal damage or any salivary gland damage, right? So lipase is what we're actually checking. And in a case of acute pancreatitis, it will be 3 times equal to or more than 3 times of the upper normal limit, right? And that is your first investigation of choice. Usually this lipase peaks in 24 hours, but it continues to be there for around 3 to 4 days, right? Yes, Dr. Kama, go ahead. Do you have a question?
Sorry, but the investigations, like the name of investigations, do we tell the patient, or we just tell that we will draw some blood to run some investigations?
You can either say this in the data gathering part itself, because remember, where are you? You are in the A&E. You can do these blood tests. Right?
No, sorry, I mean the names. Like, do I tell the patient I will do serum lipase and MLAs, or would this be confusing?
No, since if you're mentioning it for the investigations that you're looking for. So even when you're doing the examination, when you're doing examination is examination and investigations, right? So you're doing the vitals, you're doing the general physical examination, you're doing an abdominal examination, and also I'd like to order. You can also mention the names of the tests right there. So either you would get the results right away. If you haven't gotten the results right away, then you can say it as a management step, mentioning that from the examination that I have performed, it's consistent with a condition called acute pancreatitis. But to confirm this, I'd like to do a few blood tests, such as amylase and lipase, because understand that you also are being marked by an examiner. Right. So talk about the relevant investigations that you ought to be doing.
But I've heard that if we say the names of the tests, it will be overwhelming for the patient, and this will be like marked as jargon, medical jargon. So we should not say the names, but only we say in general that we will take some blood to run some tests. That's all.
So when it comes to this aspect, so when it comes to investigations, if you don't mention the investigations that you want to do, you will not get the results. Remember that, right? So if since you are in A&E, they might actually have the results for amylase and lipase. And unless you actually mention that, they will not give you the results. If you just say, I'd like to do a few blood tests, you will not be given any results. So, you want to be safe on your side, right? So when you're using medical jargon, you usually use it when you have to, identify the condition, right? Because if you're going to mention the condition as acute pancreatitis, this is something that the patient needs to know that he's suffering from, right? You can't just say that you have a pancreas condition, right? If he has to look up about this condition, he would actually have to know the name, right? So hence you would be mentioning the medical name and then following it up with a layman explanation. But when it comes to the duties that you have to perform as a doctor, mention it that way, right? So I would like to run a few blood tests to confirm the condition, such as amylase and lipase, because those are the gold standard for this condition. And this you're actually communicating to the examiner themselves.
Yeah, and consider the fact that you are also talking to the examiner. You're just not just talking to the patient, because you do verbalize things in between, right? So when you verbalize that you're not verbalizing it to the patient. Like, for example, when you say things like, I'd like to conduct a general physical examination. So that's not just to the patient, you're also talking to the examiner that way, so that they understand what you're trying to do. Similarly, so it's not a real life scenario, right? This is an exam where the patient is acting and you're also acting. So they don't think about it like you're only talking to the patient. You're actually showing to the examiner as well what you need to do. So it's always safer to be very specific whenever you're mentioning diagnosis and investigations. All right. So these are the and management, like the medications. So whenever you instead of directly saying I'd like to do some blood tests, always mention that, because the examiner might think that if you don't know what you're talking about, what blood test that you want to do, because they have a checkbox that they need to tick. Whether you ask for amylase and lipase, they need to know that. So it's always safer to mention those. Similarly, for when you mention the diagnosis, always mention the name of the diagnosis specifically. Like, these are three areas where you can use medical jargon. That is, giving the diagnosis, mentioning the investigations, and mentioning the right medication that you're going to give. Because these are very important things that you can't be very vague about. You have to be very specific about these things, because if something goes wrong, we can get the wrong investigation, management, or diagnosis. Okay.
Thank you.
Clear that out for you? Right. Yes. So because over here at this point it's just an acute abdomen. So to actually call it a pancreatitis, you actually have to do these tests in order to actually call it an acute pancreatitis. Otherwise, you can just generalize it by calling it an acute abdomen, right? So how would you be saying very surely that it most likely looks like acute pancreatitis? You can't do that without these examinations and these investigations, right? So from the symptoms, it's always, what the patients are experiencing. The examinations and investigations are what you elicit, right? And accordingly, you have to know what are the right investigations to be done in this case. All right, so moving forward, you also mentioned that we might have to do some further imaging, right? So yes, that is true. So now let's talk about the steps of what management has. So management basically is to admit the patient, keep him nil per oral because of the active inflammation of the pancreas, supplement him and supportive treatment with analgesic. So which is the analgesic that you'll be giving in this case? Anybody in this case for an acute abdomen, what is the analgesic that you'll be giving?
Codeine?
Codeine?
Morphine?
Morphine, yes, absolutely. So morphine, so in this case, you will just jump the ladder. Now you'll go right up to morphine. It's this acute pancreatitis, acute appendicitis, even MI, if it's actually an active, insult that is happening, You just go right up the, ladder, right? Rather than following the steps. Yes, you will be aggressively treating the pain, and the pain itself is mentioned it as 8, right? So the supportive treatment with that, right? Let's go through the points together. Yeah. So start nil per order to allow the pancreas to rest and reduce irritation. Inform about the immediate admission. Explain that we will need to stay in the hospital for monitoring and treatment. Consider chest X-ray to rule out any other causes, and request an abdominal ultrasound to check for gallbladders or biliary obstruction as potential triggers, right? So even though you think that it is alcohol that has been causing this, you have to rule out the other causes, right? So hence the only way you can actually rule that out is by doing your investigations, right? So even though the patient is getting admitted, you have to talk about the further management, like what is going to happen to you in hospital, right? Initiate IV fluid resuscitation with isotonic fluids to maintain hydration and perfusion. Administer IV analgesia, start with paracetamol and escalate to opioids like morphine if necessary. Give antiemetics to relieve the nausea and vomiting, because this is also a symptom that you have elicited. This patient came with nausea as well, right? So, any of the symptoms that they actually mentioned, bring it back in management. That was the whole point of data gathering of all the, symptoms they are experiencing. As soon as you understand that you've got a symptom, bring it back in management, say that we will be managing that as well, that you've been experiencing. So that's another thing, as and when you actually understand the, the discomforts this patient has been experiencing in your data gathering, try to understand which are positive, which are negative. Try to make a mental note of what all you got as positive so that you can bring it back in management and manage it. So that's also something that the examiner is looking. So since you have managed to find out that this patient has been vomiting and is nauseous, would you be giving him any antiemetics in the, in management, right? Monitor closely, regular observation, including vitals, urine output, oxygen saturation. Insert NG tube if vomiting persists. Refer to surgical or gastro team for further inputs and ongoing inpatient management. Discuss alcohol cessation. Emphasize that stopping alcohol is essential to prevent recurrence and permanent damage, right? Explain recovery and follow-up. Most people improve in a few days, but complications are possible, and follow-up will include assessment of gallstone, triglyceride, and alcohol cessation. Safety net, clearly warn about the worsening pain, fever, confusion, or vomiting, and when to alert the staff, right? Provide educational leaflets about pancreatitis and the risk associated with alcohol and the pancreas. So yeah, I guess, see, always try to do these 3 things: follow up, safety netting, leaflets, pamphlet. As soon as you hear the 2 minutes bell, start wrapping up your station. Even if you know that you don't have much time, try to list the things that you ought to be doing in management, so that, the examiner also knows that they can give you marks, that you are aware that these are the management plan that should be given to a patient with this condition, right? So one way we actually mention that is, as soon as you get a diagnosis, explain the diagnosis and talk about what all will be done for him for this condition, especially when you are short of time. Like, for example, in this case, from your symptoms, it looks like, this is acute pancreatitis. Explain acute pancreatitis. For this condition, we will have to admit you to the hospital and, give you supportive treatment in the form of fluids through your veins. We'll be giving you, we'll be treating the pain aggressively. We will also be involving the gastrology team for their further inputs, and we will also talk about ways to prevent this from happening, since I strongly believe this could be because of your alcohol consumption. Yeah. And finally, I'd like to also tell you about a couple of things to look out for, and the follow-up plan that we will have once we discharge you from hospital. And here is a leaflet so that you can read up about this condition. So what would you like to talk about first? So you're kind of stating everything because you're kind of short of time, right? So you kind of state everything one after the other and give them an option to talk about what is, what is the pressing thing for them, right? So always turn it into a conversation, but once you actually realize that there is, a shortage of time, try to mention all the things that you, would like to do right away. Yeah. All right, so let's look at the interpersonal skills. Use sensitive language and empathetic language, signpost throughout the consultation, ensure clear and structured communication, provide reassurance and support to the patient, ask if the patient has any questions or if they would like anything explained again. So I'm going to give you a partial for this one. So, but good job, Dr. Kamal. That was a great performance. I mean, for a first time go, it was great.
Thank
Do
you
you
so
have
much.
Absolutely. So we will be sending you this, the performance, so that you can actually rewatch your video and, try practicing this case again. But
Thank you so much.
absolutely, good job. That was a very well done case. All right. So that was Dr. Kamar, who just performed acute pancreatitis.
To practice this case with AI, please visit TuringMedSchool.com.